Hi everybody, my name is Dr. Lesley Tate-Gould. I'm the Executive Director and co-founder of Lido Wellness Center. And May is Mental Health Awareness Month. So I'm just here to give you a little bit of what I have come to discover as my understanding of mental health, and to just offer a few additional insights and wisdom into what it's like to be a part of a mental health community. So mental health obviously has a very special piece in my heart. I have worked as a clinical psychologist for many years. I've specialized in wide range of different presenting issues. And for me, mental health is more about broadening the scope and having some different language to use that doesn't just capture mental illness, which is kind of formally what, as a diagnostician and as a psychologist, I was a part of in my discovery of kind of navigating through this field, but more about capturing what is health, and at times what is happening when we're not with health, what is happening when we have actually more dis-ease. And so sometimes with mental health, it's not just about how we're feeling or how we're doing. It's also to be able to discover, okay, what's happening in our world, what's happening in our bodies, so then we can have kind of a better awareness of, is this something that I need to look into? Is this something that I might need some additional support, some additional guidance, or expertise? So I also want to distinguish that mental health and the awareness of it doesn't necessarily mean that everything that you're coming into maybe some awareness of, right? Like if you've just suffered a tremendous loss and you're going through grief, it's not about pathologizing that grief, but it's rather about giving it some actual honoring and some attention that it's due, to also be able to say, wait a minute, like I'm actually going through grief, and this is a real thing, and it demands and deserves my respect and that of those around me. So with the awareness of what mental health is, it's also to reimagine that we're more than just kind of the body that we walk around in on a day-to-day basis. We are a very complex mind. We are a complex emotional system. We're a complex feeling and sensing, being. And we also have a great impact and awareness of what's happening in relationships around us. And so also with mental health awareness, I also know just with not only the patients that I work with, but also just in my own, personal experience in life, that we also don't have any guarantees of what we will come into contact with in our day-to-day time here on earth, right? So that could be as complex as having maybe experienced something that we might distinguish as trauma, or something really, really devastating or difficult in our early, very formative and early developmental years. Or it could also be as abrupt and severe as maybe you're driving down the 405 and you rear end someone, or you have kind of a really shocking experience like a car accident. Having awareness that we all have impacts, right? Like we all come from a different family. We have people within that family, and comprising of this really intricate and almost like a cultural landscape within that family system, that also is going to impact how we're going to then look out into the world, how we're going to perceive things, how we're going to take in new information. And those different ways of internalizing and having awareness of information can also be greatly influenced by wonderful things that have happened to us and that people have brought into our lives, or maybe really heart-wrenching and really terrible and terrifying things. So to back it up back to that original question of, what is mental health awareness? It really is that key word of awareness, right? It's holding greater awareness and honoring of, what am I, maybe having great joy with great exuberance, great love and vitality, or where in my life am I having and holding awareness of what's not working? That might be what's not working internally, or what's not working in my environment. depending on how we were raised and whether we were given a great model for holding great awareness to what's happening in our bodies, what's happening with our feelings, this may be an area for us that's quite uncomfortable. I recently led a talk in Los Angeles about how many of us have certain feeling groups that we would rather not have to engage in throughout the day. And so sometimes holding, greater awareness of what's happening with our mental health. And this is also extremely useful to also be able to discern where is something potentially heading into a diagnosable disorder or condition. And the only way sometimes that we can know that is if we are stopping and paying attention to what might be the natural feedback that our body and our embodied feelings are providing to us. So I'm such a big believer in our body's ability to hold a tremendous amount of wisdom, and I know I'm not alone in that belief. And so I tend to see in my practice a tremendous amount of physiological symptoms emerge when there maybe is a disconnect with really noticing and honoring with greater awareness what is happening. So for instance, like if we are ignoring something like fear response that's coming online and that's really grabbing us in our chest, and if it's induced by an environment that's really not helpful to us, that might actually even at times be quite dangerous. By ignoring some of those natural physiological responses that our body is so highly programmed to do and to offer us primitively, by ignoring that, we're basically teaching our body to diminish some of those natural kind of almost like a smoke detector. We're ignoring some of that energy and that awareness that our body's saying, hey, you need to pay attention to this. This is really important. We need to kind of change course or do something differently here. And so if we have chronically, maybe out of even necessity, had to ignore, maybe if we had an environment when we were young in which it was actually dangerous for us to respond in a way that was to seek out help or to use internal agency and resource, then sometimes our nervous system, our body itself, will start to present things like syndromes or symptoms to essentially give us something that we can no longer ignore. So common ones that I tend to see in our practice here at Lido is we'll see the development of migraine headaches. So migraine headaches, believe it or not, have a lot to do with our fear response system. So if we've been having to chronically hold in or stifle or manage fear, then energetically, when we might have some exposure to that fear, that intensity will rise up. That tightness and all of that constriction and tension will rise up, which at times can then lead to somebody experiencing the frequent symptoms associated with a migraine. And then sometimes people will say, well, gosh, like I've not allowed myself to feel something like fear or anger because there was too much risk. And so in our adult lives, it's also about how can we hold greater awareness of where are those kind of channels, where are those safe places and those havens in which we can start to really feel things at a deeper level so that we don't keep having, whether it's a physical syndrome like a migraine, or we don't keep having some of those challenging interpersonal dynamics that can also happen if we've really had to stifle or hold in feelings. Mental disorders, I learned once that from an old supervisor of mine, she used to say that anything that you find in the DSM is some frequency completely out of balance. And so even with if we hold that conceptualization as true, then even something like depression can look like, okay, is this sadness and immobility out of balance, right? It's why we also diagnose grief differently than depression, because grief is a really appropriate mode and expression of deep and at times prolonged sadness. Whereas depression, there is kind of that biomedical approach and understanding that sometimes when there's so much out of balance that it can actually have a relating impact on our body itself. And so it's how do we start to, with greater awareness and really permission, right? We need to be able to give ourselves as a human species permission to say, this isn't feeling right, or I'm noticing something's really off. And how we can also then decipher, is this something I really need to actually seek out some additional support and maybe from a professional? Or is this something that I can really utilize some of my really known and accessible coping strategies for? Things like supportive movement, social engagement. Gosh, after the year that we've all been through, if there is not such a pillar of the importance of social engagement, then having survived a pandemic, that's such a good reminder that as social creatures, we need to be able to seek out that resource to be able to weather that storm with a community and a group around us. So, with distinguishing, mental health disorders from that mental health awareness, they're both kind of interrelated, right? We need to be able to give permission to have the awareness so that we can also hold the great awareness and discern where might I actually need and deserve some additional guidance and support from a professional setting. As the founder and executive director here at Lido Wellness Center, I still also get the privilege to be a clinical provider here in our treatment center. And one thing that I tend to mention, even though it might not in the moment be absorbed when I'm in a group of patients, is that I'm often seated amongst some of the most courageous people that I've ever had contact with. And what I mean by that is it takes a lot of courage to be able to come into, especially a group, let alone an individual session with a therapist, and to be able to really start to confront some of those things that are no longer working for you. And so I find that in that position as a provider, I get such an opportunity to really be able to witness with great respect and compassion what somebody is going through. And so it's also really contributed to me holding awareness while I'm not perfect at it. And at times it's so helpful to be reminded in a lovely way from my fellow colleagues and from some of the work that I've done, is that we don't know what somebody's gone through, right? We don't know unless somebody is able to and feels safe and vulnerable to be able to share that so explicitly with us. And so sometimes we might make the assumption or we might kind of jump to a conclusion, which in my own work, both personally and professionally, I've also learned is often from our early training in our young years, right? We receive information, we receive messages, we receive beliefs and ways of thinking that at times in our adult years, we might assume, right, or kind of grab onto, well, gosh, when this person said this, they meant this. But so often we don't take the time, or nor have it for that matter, to really be able to suss it out, to really be able to say, hey, this landed on me this way, and I'm wondering what you meant when you said blank. And so I think it's so important to be reminded that to hold great respect and empathy for the fact that we all come from a different rich fabric and background. And it's so valuable to be able to also at times be able to envision with great esteem that somebody is doing their very best, and the way that they might do something might look vastly different from the way that myself or somebody else might do something. So with that in mind, it's being able to also hold great respect and awareness that something like when somebody has a mental health diagnosis, it's often still something that they might have a lot of privacy around. And it's also, like I mentioned before, it's quite privileged to be able to hear and understand with compassion some of what somebody might be going through. And so it's just such a loving reminder that, you know, we as human beings, that we really need one another. We need to be able to have a sense of restored community, and also knowing that on a day-to-day basis, we might be going through something. We might not be bringing the best version of ourselves to work or to this relationship. But what keeps me coming back to this field day after day is also knowing that we have such an amazing, resilient spirit. There's such an incredible gift to be able to sit across from somebody individually or in a group and see things changing, see the way that they're thinking change, see the way that they're emoting to others or connecting deeply interpersonally start to improve. So I'm so deeply committed to this work because I also know that people are capable of change. They are capable of growth and their own personal journey of healing. So here at Lido Wellness Center, our mission is to be the last treatment center somebody will need in order to live a life of great potential and fulfilled wellness and health. And so our hope is that if you are, an individual that really just needs some additional support, that needs some additional guidance and some time maybe set aside in which you can really prioritize with great awareness and discovery your own mental health needs, that our team is here to help. And so you can contact us on our admissions line. You can find our information on our website and our social media. And we hope that we can help you and support you on your healing journey.